Hello, my name is Shatan Haley, and I am the Victim Services Program Manager at the Illinois Criminal Justice Information Authority. Today, I will be discussing the Notice of Funding Opportunity for the Victims of Crime Act, also known as VOCA, Human Trafficking Victim Services Program. The Victims of Crime Act funding is federally administered by the United States Department of Justice, Office of Justice Programs, Office of Victims of Crime, also known as OVC. VOCA grants must support the provision of direct services to victims of crime. States are required to allocate a minimum of 10% of funds received for services to each of the following: victims of sexual assault, domestic violence, child abuse, and underserved victims of violent crime. VOCA funds may not be used to supplant or replace state and local funds that would otherwise be available for crime victim services and must be used to develop new projects or expand existing projects. This funding opportunity is an effort to improve services for and/or the response to persons who have experienced human trafficking, including sex and labor trafficking. The Illinois State Police define human sex trafficking as inducing a person by force, fraud, or coercion to participate in commercial sex acts, or in which the person is induced to perform such acts has not attained 18 years of age. Attempts are included in labor trafficking or human trafficking, involuntary servitude as the obtaining of a person through recruitment, harboring, transportation, or provision, and subjecting persons by force, fraud, or coercion into involuntary servitude, peonage, debt bondage, or slavery. Attempts are included. ICEJA has made available a maximum of $800,000 in VOCA grant funding to improve services for and/or the response to victims of human trafficking. This opportunity will support nonprofit, non-governmental organizations, including faith-based and other community organizations that provide core services, direct intervention, and related assistance to these victims. Funded programs must offer direct services in response to sex and/or labor trafficking victimization or assist direct intervention in response to trafficking victimization. Services include the following. Required services are information and referral. Providing information includes educating victims on how the criminal justice system works, their rights as victims, and how to apply for crime victim compensation. Referrals involve connecting victims to providers who are better able to meet the needs required for specialized services such as mental health and legal professions. Advocacy and emotional support and safety. Advocacy refers to assistance provided to help address victims' physical, legal, and financial needs, and obtaining housing. To address victims' physical needs, advocates assist victims in applying for public benefits and obtaining housing. It also includes providing supportive services such as child or dependent care, transportation assistance. Legal advocacy involves notifying victims of criminal justice system events, such as arrest and court proceedings, and accompanying them to court. Victims' financial needs are met through employment, educational, and economic assistance services that empower victims to work towards financial stability. Advocacy may also include building collaborative relationships with community partners and referral networks to ensure survivor needs are met. Emotional support and safety. Services are services that provide emotional support and safety to victims, including crisis intervention, counseling, support groups, and emergency financial and relocation assistance. Crisis intervention and counseling service may be available in person or remotely. Optional services are additional direct services agencies may consider offering, and they include comprehensive mental health and support services. Comprehensive services may include therapy, medication management, and outpatient substance use disorder counseling. Methods of delivery shall be flexible, increase service access, and remove barriers by providing services in locations that meet the victim's needs, such as on site, in the home, in the community, or in other locations. Survivor-led mentoring and support groups should include paid staff positions, public awareness and outreach, and the identification of programming that is aimed at increasing awareness of human trafficking services and the identification of human trafficking victims. Required program components include survivor-informed policies and practices. Programs should be designed and implemented with intentional input from individuals who have experienced human trafficking to ensure the program best represents their needs. Survivor consultants should be compensated for their time and expertise. Victim-centered services. Victim-centered services requires providers to systematically focus on the victim's needs, interests, perspectives, and concerns to ensure compassion, culturally sensitive, and linguistically appropriate delivery of services in a non-judgmental, caring manner. Valuing a victim's input, safety, and well-being are top priority. Trauma-informed approach. The applicant is required to provide services that integrate trauma-informed practices, including strategies for mitigating vicarious trauma among staff. Vicarious trauma occurs when providers experience traumatic stress reactions as a result of exposure to another person's traumatic experiences, rather than from direct exposure to a traumatic event, and includes hearing or learning about others' victimization. Applicants should describe their current use of trauma-informed practices and identify strategies for monitoring their implementation. For more information on trauma and trauma-informed care models, see the trauma types and promising approaches to assist survivors, which is included in the NOFO instructions. Applicants should incorporate one or more of the following activities to address vicarious trauma among staff, because improved staff health and well-being can result in improved services for victims of crime. Weekly self-care groups to build staff skills through debriefing or activities that assist staff in processing and learning new skills to address vicarious trauma. Groups may incorporate yoga, instructions and new coping skills, or may provide a space for staff to debrief. Consistent, regularly scheduled supervision to ensure staff are well supported and have the tools and resources needed to provide quality services. Policies and/or protocol development that prioritizes staff well-being and vicarious trauma, provided their development relates to direct services or staff supervision. Culturally responsive and accessible services. Culturally responsible and accessible services are respectful of and relevant to the needs of victims and survivors with diverse identities and lived experience. As such, the applicant must incorporate the following program elements: a low barrier screening and intake process, hours of operation and intake beyond traditional daytime working hours, translation and interpretation services, transportation support for clients, and assistance with child or dependent care. Lastly, capacity building. Applicants that are unable to provide one or more of the above optional services, or if the applicant agency currently lacks capacity to provide services related to both sex and labor trafficking, applicants must propose a plan to ensure funded staff will receive training to serve all victims of human trafficking. For example, an applicant with experience servicing sex trafficking survivor who has no experience serving survivors of labor trafficking should demonstrate a plan to build their organization's capacity to meet the needs of labor trafficking survivors. Plans should include training as well as meaningful collaboration with partner agencies or service providers. The required staffing include a full-time case manager. Applicant organizations must utilize grant funds for a case manager or similar position to serve as the primary point of contact for clients, beginning with intake and continuing with service coordination. Responsibilities would include, but are not limited to, assisting with intake, building collaborative partnerships with referral relationships with service providers, providing referrals and information for clients that do not meet program eligibility criteria or that the program is unable to serve due to capacity limitation, maintaining case files and completing client reports, coordinating services for clients both within the agency and externally with partners, providing crisis intervention, and informing clients of crime victim compensation programs and helping them submit an application. Direct service staff, sufficient staffing to provide the proposed services for all clients to be served. Staffing plan should include the ability to serve clients with various levels and length of service needs. The intent is to anticipate engagement in long-term services when needed. And lastly, a supervisor. Ongoing supervision of direct service staff to ensure program fidelity and staff support. Optional positions could be a community outreach specialist who promotes the program, engages in community outreach, networks, and collaborates with results and referrals to the program and assists in the identification of community resources. The program also has a required training component. Human trafficking. Applicants must ensure that staff complete at least one training during the grant period to address needs of survivors of sex and/or labor trafficking. Training should extend the agency's capacity to serve all survivors of trafficking. A focus on providing inclusive, accessible services is recommended. The details and content of the training must be documented. Trauma training. Agencies should hold at least one training on trauma for all program staff during the grant period. This training should build the staff's capacity to respond to and support trauma victims and should provide education on vicarious trauma and self-care. Agencies are strongly encouraged to take additional steps toward building internal capacity for engaging in trauma-informed care, such as the development and use of trauma screening tools, policies, and practices that mitigate vicarious trauma, and the use of program assessments to gauge agency trauma readiness. Activities and costs associated with the proposed trainings must be thoroughly explained and justified in both the program narrative and the budget narrative. Eligible applicants include nonprofit, non-governmental organizations, or tribal programs that provide services and related assistance to human trafficking victims and their families. Applicants with demonstrable experience serving human trafficking victims are encouraged to apply. And because this funding opportunity aims to expand the availability of services to human trafficking victims across Illinois, organizations with demonstrable histories of serving victims of all other types of sexual violence are encouraged to apply, with a proposed plan to ensure that funded staff will receive sufficient training to serve victims of human trafficking. Applicants must also be qualified to do business with the state of Illinois. Cost sharing or matching. Please note, as per the National Emergency Pandemic Mandatory Waiver Policy, no match is required for this application. Match funds, however, will be required for grants covering the second year of the period of performance. In the event the applicant wishes to decline the match waiver and include the match in the submitted budget, match is calculated as 20% of the total cost of the funded program. Federal grant funds requested under this application may not exceed 80% of the total cost of the project. Match can cash and/or in-kind contributions. Cash or in-kind resources used as match must be spent in support of the program's goals and objectives. Now, the goals, objectives, and performance measures. Funded programs will be required to submit quarterly progress and financial reports based on the objectives applicant agencies propose in their response to this solicitation. Grant awards resulting from this opportunity will have a period of performance of January 1st, 2024 to December 31st, 2024, a total of 12 months. Additional funding for up to 12 months may be awarded after the initial funding period, contingent upon satisfactory performance and availability of funds. Total funding for the grant program will not exceed 24 months. Also, a total of $800,000 in funding is available through the solicitation, and applicants may request a minimum of $125,000 and a maximum of $175,000 in grant funding. Please forgive the typo in the PowerPoint presentation. The requested range of funding is $125,000 to $175,000. To be considered for funding, applications must be completed and submitted via Amplifon by the application deadline of 5 p.m. on November 6, 2023. If you have any questions can be submitted via email at cja.humantraffickingnofo@illinois.gov. All substantive questions and responses will be posted on the ICJA website listed here. The frequently asked questions will be updated every Friday. The deadline to submit questions is 5:00 p.m. on Thursday, November 2nd, 2023. Thank you and good luck with your application.